What I would say is that anybody with lung cancer can potentially participate in a lung cancer clinical trial. It will really depend on where you are in your treatment course, but there are potentially clinical trials available at all parts of your disease process. Some trials may be open for patients who have not received any other prior treatment. Some trials will be open for patients who've had surgery to remove their cancer, but don't have any evidence of any cancer right now. But it also could be in patients who have already received all the standard treatments and there aren't really any other standard treatments available. And so it really will depend on where you are and which studies are available at the place that you are. But I think it's really important for patients with lung cancer to really ask about clinical trials because there may be trials that are open that they may not be aware of. When a doctor talks to you about a clinical trial, there are always going to be eligibility criteria that determine whether or not you can participate. So regardless of wherever you are in the disease process, the clinical trial in the protocol will have a specific criteria that will say whether a patient can participate or not. And it's really going to be individualized to each protocol, which patients they can include in the study. And there are both inclusion criteria that you need to meet in order to be included. And there are exclusion criteria, which might say, well, because of a certain circumstance that you cannot participate in this clinical trial.